My job as a holistic midwife and traditional healer is to give you solutions for your health problems that you're not going to find anywhere else. When I first moved to Cincinnati, Ohio, I shared a house with an OBGYN resident. She told me that in the given course of a year, she was supposed to get 20 vaginal births. And there was no way she was going to be able to get 20 vaginal births at UC Hospital. She said that on certain days she would help with about 8 C-sections a day. So when you go to an OBGYN, do you think that you're going to somebody that really knows what birth is? When you see a midwife, we understand what normal birth is. We will have clients in labor sometimes for 2 or 3 days, and we may not necessarily be there the whole time, especially if they're in early labor, but we are comfortable labor sitting with people. We go through the whole experience. If an OBGYN resident is not seeing even 20 vaginal births in a year during their training, think about what that means. You have a hospital birth, you have an OBGYN, you go to the hospital when you're in labor and you get seen by the nurse, and sometimes the OBGYN or the attending OBGYN resident comes in and checks your cervix and checks on you. And usually most of your labor is not with your OBGYN in the room. They come in maybe at certain intervals, every shift change, every 12 hours, or if you make significant progress, and then they come in to deliver your baby. That is completely different than a midwife who is with you during the birth process and understands you and what's normal for you and has developed a relationship with you over the course of the pregnancy, and then has seen you in early labor, in active labor, and understands what the birth process is. So I tell my clients who I teach childbirth education to, if you go to McDonald's, you don't expect to get sushi or a nice steak. You expect to get a burger. If you go to an OBGYN, they're trained surgeons. You expect to get somebody who understands how to perform a good surgery. If you go to a midwife, you're going to somebody that is the expert in normal physiological birth.